Syngo CT Dental workflow assists you in planning for dental surgical procedures like dental implants, mandibular cosmetic surgery, or facial trauma reconstruction. All of these procedures usually require an assessment of the actual makeup of the bone and a three-dimensional and cross-sectional view of the jaws. Let's take implants, for example. Implant cases call for a complete evaluation of the complex mandible and maxilla structure, as well as an assessment of the alveoli, the jawbone thickness, and the path of the alveolar nerves. Therefore, an accurate application is essential to reformat CT data into accurate panoramic and paraaxial images. Syngo CT Dental gives you information on the exact location of anatomical structures, the contours of the jawbone, and enables you to choose the best sites for implants before surgery. The true size images allow the dentist to accurately measure the amount of bone that is available for implants. The Syngo CT Dental solution therefore helps determine the best treatment solution. This movie will show you how to evaluate CT dental cases using Syngo. First, make sure that the study is correctly assigned to the CT dental workflow. Otherwise, right-click and select Open with CT Dental. The layout of the screen is automatically selected depending on the monitor configuration. In this case, the study is open in with 1. A lateral MIP segment, 2. A panoramic planning segment, 3. A paraaxial planning segment, 4. A panoramic result segment, 5. A block of paraaxial result segments, 6. The range parameter panel, 7. 3 MPR segments, and 8. A VRT segment. Now let's start with the clinical workflow. First, adjust the reference plane over the MIP segment to find the desired orientation. Just move or tilt the middle green line until you get a proper view of the jaw in the panoramic planning segment. Move the upper-lower green line to adjust the height of the paraaxial images to be generated. Notice the window corrections can be performed in any segment by dragging the mouse vertically and horizontally while pressing the middle button. The left mouse button provides zooming functionality when the cursor is located in the periphery of the segment, or panning functionality when the cursor is located in the center of the segment. The cursor changes its shape to show which function is active as a standard functionality, which remains the same in every other segment as well. Navigate by dragging the mouse vertically while pressing the right button or by scrolling with the mouse wheel. Now that you have a proper orientation in the panoramic planning segment, you can create a centerline to define the panoramic and paraaxial reconstructions. Just left-click to set multiple control points along the jaw. If you want to correct the centerline, simply click on the Edit icon in the Case Navigator. Then drag any of the control points to the required position and click on the Edit icon again to confirm the corrections. Changing the length of the centerline is also very easy. Just move the yellow lines in the paraaxial planning segment. Keep in mind that the lingual marker, shown by a yellow cross, is placed on the lingual side. That reference will be used to label the paraaxial orientation with B, buccal, or L, lingual, which are defined according to the position of the lingual marker. Now that the centerline is defined, the panoramic and paraaxial ranges are calculated according to the current values in the range parameter panel. To accelerate your workflow, you can create your own presets if you need specific values. The slices of the panoramic range are represented by white panoramic lines that run parallel to the centerline in the panoramic planning segment. The corresponding panoramic result images are displayed in a stack in the panoramic results segment. Be aware that the relation of the panoramic lines and the panoramic result images is indicated by numbers. In the panoramic planning segment, the defined centerline is highlighted in green. The corresponding panoramic line of the currently displayed panoramic result images is highlighted in red. Use the mouse wheel to navigate along the panoramic slices or click on a panoramic reference line in the panoramic planning segment to select a panoramic result image. Handling the paraaxial range is very similar. The slices of the paraaxial range are represented by white dashed and solid lines distributed equidistantly over the paraaxial planning segment. The set of paraaxial reconstructions shown in the paraaxial segment is highlighted with a white solid curve in the planning segment. Additionally, the paraaxial image, which is in the middle of the range, is framed with a red box in the results segment and shown as a red line in the paraaxial planning and in the panoramic segments. The three MPRs are always orthogonally synchronized to this position. Navigate by scrolling with the mouse wheel over the paraaxial segments and notice how the red lines move accordingly. You can also left-click directly in any position of the paraaxial planning segment where you want to navigate. The height of the paraaxial images can be easily modified by adapting the green border lines over the MIP segment. Would you like to perform some measurements within the application or directly on your lightbox? If you prefer the digital way, simply go to the MPR segment, which is aligned to the current paraaxial view. In the upper right corner menu, choose from different measurement tools, for example, a distance line. Any measurement will be collected in the Findings Navigator for further archiving. You can also perform the measurements directly over a true size film sheet if you wish. Simply go to the Save and Print All icon in the Range Parameter panel. All result series will be stored for further archiving and sent to the print workflow step with true size. Finally, in the print workflow step, you can select the layout, paper size, and print your images. Remember that all images are true size, so zooming is not active by default. Results are also conveniently collected in a report. To save and archive this report, the results series, and to complete the workflow, simply click the Save and Send button.